My name is Susan Wilson. I began with Northwest Health as the financial officer. Shortly after that, had an opportunity to apply for the executive director position, which I did, and was fortunate enough to be appointed by the board. Some concerned community citizens in Holt County kind of looked around one day and realized that all of their doctors were aging and were experiencing health problems, and they were kind of worried that they might be without medical care. They formed a group. They applied for a planning grant and received some funding from the federal government. I think they spent about 2 years actually planning the launch. The way they started Northwest Health is that they acquired local practices and then employed the physicians.
From the very beginning, when the community health center model was developed, it became obvious that the investment that a community makes in making primary care accessible to citizens makes a huge difference in the vitality of the community and the general health of the people who live there.
There were 2 in Mound City and 1 in Oregon. Not too long after that, one of the physicians who was in the county actually did pass away, and his widow came to Northwest Health's board and asked if they would include Maitland in the health center. So they did. During that time, we became aware that the clinic in King City, they were looking for someone to help. We eventually opened a Northwest Health location in the facility in King City. I believe that was in 1994. In 1995, the health center in Hamilton was needing an executive director. The health center director in Kirksville at the time and I partnered to manage the health center in Hamilton, and they had a location in Bramer as well. In 1996, I was contacted by Charlie Shields at Heartland about converting their youth health center into a community health center location. I suggested that we have a conversation about a network of health centers in Northwest Missouri. When we began those discussions, the folks in Hamilton decided that they might want to be part of that as well. In 1997, we merged Hamilton and Bramer with Northwest Health, and we also took over 4 clinics that Heartland had been operating.
Different clinics have joined the organization in different ways. In Hamilton and Bramer, the clinics were part of the county health department. They stopped providing that function and became part of Northwest Health Services. In communities like Canesville, there was an independent clinic that was owned by a provider who was struggling.
They were preparing to close that location and didn't want to leave the physicians with no support in the community. Heartland was unable to absorb them at the time.
We actually ran the clinic for 4 years. Then we sought out assistance to see who could support the clinic to keep it open. When I walked into Northwest office, Susan Wilson was like, well, let's see what we can do. And she opened my numbers and she says, well, I think we can help you.
We had the opportunity to apply for additional funding to support Canesville. It was initially denied. We eventually went to our congressional representative and just laid out how dire the situation was to him, and he was able to move us up on the priority list to be funded. So we were able to support Canesville.
She really learned about the community before Northwest Health Services made the commitment. That's the reason the clinic's still open, is because of Northwest.
I mean, even though it's technically owned by Northwest Health, the community there has an ownership interest in that clinic. And that's what health centers are all about. It's about local communities taking an interest in their own health care and supporting it.
Being being involved in all the community organizations, being involved with the health departments, that's a huge connection for our community because we're not working against each other, we're working together. We just needed to have people see us other than inside the clinic walls, showing that we cared. Whether they're inside the clinic being a customer or they're there living in our community, we're willing to give back.
In 2002, we began the discussions about adding some additional locations in St. Joseph. We were able to access Health Resources and Services Administration expansion funding to open the North End Clinic and the Southside Clinic. And the third leg of that was the Med Clinic in Savannah. As opportunities came to us, we were able to access resources to address those needs.
When Northwest moved into St. Joe, we didn't provide dental services here at first. The dental need is so great, ultimately moved into the Aldi's grocery store location on the Belt Highway when that became available. Put up a 16-bay dental operatory to meet the needs of the community there. And part of the building now has been expanded, to provide behavioral health services also. As the community needs change over time, the primary care services that we try to provide also change.
Mental health became a priority for us, even more so when we moved into St. Joseph. We partnered with Heartland to begin offering psychiatrist services not too long after we moved into the family medicine facility.
Wherever we provide services, we find some type of arrangement where we can offer primary care, medical, and dental services and behavioral health.
One of the most important decisions that the board had to work with the administration was on recruiting the personnel that would work in the organization and make sure that they were a good fit. Some of the population that we serve has difficulty in complying with the diagnosis and the prescribed treatment, so they take some extra care and attention. If we could get people that would work with our patients to make sure that they were seeing all of those services, we could do a better job of providing care for that population.
We call it a community health center, but it's one community health center spread across 15 counties. As fast as we can get to more locations to serve more people, we're going to get there. I just want to thank our staff and employees at Northwest Health Services, the board members, people who donate their time, who come in and provide the services that we need to fill a very important mission in the communities. We are just coming into a point where we can very meaningfully begin to meet the needs of some serious health problems in very remote areas, very underserved areas of the state. And you provide such an important, critical role in our communities, and no one can thank you enough for it.